From KUNC and the NPR network, this is In The NoCo. I'm Erin O'Toole. For a lot of people, being stopped by police can produce a wave of anxiety. But that sense of stress and uncertainty is even worse for people with certain conditions. Think neurodivergence, autism spectrum disorder, deafness, Tourette syndrome, or dementia.
What's already a heightened, stressful situation can be exacerbated if there are the potential for communication barriers.
That's Alistair McNiven, the chief of staff for Boulder Police. He helped bring in a new tool the department rolled out recently to help people with disabilities communicate when they encounter an officer. It's called the Blue Envelope Program. It allows a person with a disability to get a blue envelope from the police department and fill it out with information an officer might need to know to communicate with them. Then, if they're stopped by police, they hand over the envelope. Boulder's program, which launched in January, was the first of its kind in Colorado. Since then, a handful of other police and sheriff's departments across the state have implemented a Blue Envelope program, including Fort Collins Police last month. I spoke with Boulder Police Chief of Staff McNiven earlier this year about why he thinks the envelopes may be a transformative tool for police officers. We're listening back to that conversation today. He began by explaining what kind of challenges officers may face if someone they stop has a disability.
Well, there are times at the beginning of an interaction with the driver, for example, where there can be a misunderstanding on the part of the officer as to why someone might not be making eye contact with them, might not be responding to any questions that might be asked of them, and they might attribute that to something other than, for example, a disability, if they're unaware of the disability in the first place. They might think the person could be intoxicated or, for whatever reason, just wasn't willing to cooperate with the officer.
Right.
Rather than because, for example, he couldn't hear the officer, or because of an enhanced anxiety, or is having problems processing what the officer's saying.
I want to touch on a broader movement in the law enforcement community about how police work needs to be more sensitive to people who have these unseen disabilities. In 2020, Douglas County deputies arrested and handcuffed a child with autism, which led to a lawsuit. In 2021, Loveland police arrested and used a taser on a senior citizen after she walked out of a store without paying for items, which led to several resignations. Both of these incidents point to a need for more training for law enforcement officers, but also maybe a change in mindset. How does a program like Blue Envelope kind of fit into this conversation?
Well, I think the important piece that we focus on is the ability to communicate with all members of our community, regardless of whether they have a disability or not. It's also important to recognize that having a communication barrier that may exist because of a disability just makes it that much harder to communicate, and it makes it more likely for there to be a miscommunication. You know, in our jurisdiction, we haven't had the kinds of tragedies that we've seen across the nation as a result of these misunderstandings, but I think that it's important, if we can, to try and prevent those sorts of outcomes. And this is just one of a number of strategies that we've employed.
I know Boulder also has an autism awareness decal program. These are stickers that people can place on their car or in the window at home to signal to police that they or someone associated there has autism. How does the Blue Envelope initiative work in conjunction with that?
The Blue Envelope program is just another tool to use. For some people, they might not be comfortable putting a decal on their car.
Sure.
One that mentions the police, or they perhaps would just prefer to keep this, whatever disability they may have, private.
Yeah.
An example might be, and this is feedback we received from the Tourette Association of America, an individual with a tic disorder may be working very hard to overcome those behaviors associated with whatever tic disorder they might have, and they may not care for other people to know their business. And they can have that information written on an envelope, handed to the officer, and the passengers in the car, for example, are none the wiser.
Well, let's talk briefly about how the program works. Someone drops by the station to get one of the blue envelopes, or they can request one by email. What kinds of messages do people write, and what gets placed in the envelope?
The envelope has on one side the ability for the participants to put their name and emergency contact, and there are a series of check boxes for a number of invisible disabilities. And also, someone could put in important notes that might be helpful for an officer to know. Also on the envelope are reminders to an officer that the individual who hands them that envelope may be unaware of danger, they may be nonverbal, they may need additional time to respond, for example. One thing I also didn't stress is that you may still get a ticket, right? But the officer will have a better understanding of how to communicate the process to the driver. So it's less of a mystery, and maybe there's a chance to lower the stress levels of that individual.
You got a lot of input from people in the disability community for what the envelope should say. I'm curious if you heard in some of those feedback sessions, I mean, was there a particular encounter that someone had that was a bit challenging, or any conversation that really stuck with you after talking with folks?
Well, one I really remember very clearly is an individual from the deaf and hard of hearing community who had a very frustrating encounter with a police officer on a traffic stop. When she had reached for her primary communication device, which is her phone, the officer interpreted that as a movement that he should be concerned about and reacted in a manner that was threatening to her. And so it's just a very unfortunate interaction, and has stuck with her to this day. And that's another thing about this Blue Envelope program. We're hoping to decrease the number of those kinds of encounters, and certainly the severity of those encounters, because it doesn't have to be a tragedy for it to be a negative impact.
Right.
Any one of us can remember the time that we've been treated with, I think, with a lack of respect. Nobody likes that.
You launched the Blue Envelope program in January. I'm curious what the response has been like in these first few weeks.
The response has been, frankly, overwhelming. It's wonderful. Well, we actually ran out of envelopes, I think, on day 8 after the press release.
Oh, wow.
Somewhere around that time, that's a great problem to have. We immediately, as soon as we recognized that we were going to be running out, we reordered them, and we have our new batch.
I am curious to know, have you gotten pushback from law enforcement officers or perhaps people in the community who are not as excited about the program?
We haven't had any pushback from law enforcement. We've had some individuals within the community who were concerned that the program would store people's names in a registry, for example, and nothing could be further from the truth.
Okay.
You don't have to prove to us that you have a disability. If you request an envelope, we will provide one if we have one available.
Alistair McNiven is Chief of Staff for the Boulder Police Department. I spoke with him about their Blue Envelope program in February. Since then, other agencies across Colorado have implemented the program, including the Adams County Sheriff's Office and Fort Collins Police. We'll have more information in our show notes and at kunc.org. That's it today for In The NoCo. I'm Erin O'Toole. Thanks so much for listening.